Hello, everyone, and thank you for joining me today as we continue our discussion in Chapter 50 Disorders of the Endocrine System. Today, we're going to be talking about disorders of the parathyroid gland, starting with hyperparathyroidism. So, hyperparathyroidism can be a primary cause of adenoma or increased secretions of the parathyroid. Secondary, it can be increased secretions in response to hypocalcemia. So, our assessment findings for hyperparathyroidism will be fatigue, hypotonic muscles, skeletal tenderness, and pain, as well as cardiac dysrhythmias. Now, on your PowerPoint, there is a link to hyperparathyroidism, and it's a Mayo Clinic video. Take a look at that, and that may help you better understand hyperparathyroidism. Now, to diagnose hyperparathyroidism, we're going to do our lab test because, of course, we're looking at those hormone levels. We're also going to do MRI and CT scans because we're looking for that adenoma. We're going to treat that client with some sodium or phosphorus replacements, and we could even do surgery if necessary. Now, as a nurse, our nursing management is going to include monitoring the I&O. We're going to look for the development of renal calculi or urinary calculi like a kidney stone. We're going to encourage self-care, and we're going to provide that safe environment because with the hypotonic muscles, they can have that weakness and lack that muscle strength. So we want to make sure that you provide that safe environment for the client. Encourage PO fluids because we want to try to avoid the development of that urinary calculi, and provide any postoperative care should they require surgery. Your client education is going to include the effects of the disease as well as adherence to their medical treatment. Now, when we talk about the hypoparathyroidism, this is your deficiency or your underproduction of the parathormone. So you have a deficiency of the parathormone, and that can be related to trauma to the glands or hypocalcemia. So your assessment findings are going to be tetany in nature. So you can have a Cavitec sign, and that Cavitec sign is characterized by muscular twitching of the face while you're tapping over the facial nerve located in the front of the tragus of the ear. Your Trousseau sign, you're going to be looking for a carpopedal spasm. So this is noted by taking the blood pressure cuff and placing it on the client's arm. You're going to inflate the cuff to 20 millimeters of mercury higher than the systolic pressure. And you're going to hold that cuff pressure for 3 to 5 minutes or until you see that sign, or basically until you see that sign observed. And it's usually going to be no longer than 5 minutes that you're going to hold that pressure on the arm, and you'll see that sign. So make sure you know the difference between the two and how to perform those. The client may also have some laryngeal spasms as well. So your medical management, we're going to give them some IV calcium. So yes, we're going to give them some IV calcium. You may have to intubate this patient because when those cardiac symptoms can be pretty significant. They may require mechanical ventilation once you intubate them as well. So you may have to put them on the ventilator. And they may require some oral calcium once the condition is corrected, just to kind of maintain that. Now, I do have a picture of the two different signs and how to perform the Cavitec and the Trousseau signs and what they would look like and how you would perform them. Know that with the hypoparathyroidism, you're going to do a complete drug and medical history, monitor for those signs of tetany, be prepared to administer that IV calcium, observe for any adverse effects during the calcium administration, keep emergency tracheostomy equipment available, prepare for mechanical ventilation. Artificial airway and endotracheal equipment should always be at the bedside. Assist the client with all ADLs, and client teaching is also necessary. So hypoparathyroid is very can be life-threatening. So you have to be on your toes whenever you have a client with hypoparathyroid.